Hi, in this video we'd like to discuss PCOS once again, talking about diagnosis and treatment. And today's topic we'd like to talk about PCOS and oligomenorrhea. So oligomenorrhea is another key distinct symptom of PCOS where the patient is experiencing infrequent and irregular menstruation. So these patients have either longer cycle, far longer than their normal counterparts. They have cycles up to 35 days, 40 days and upwards, up to 60 days as well. So they menstruate very infrequently, only a few times a year, and then these women will only suffer from unable to getting pregnant. And even if they do get pregnant, because of the egg quality, it doesn't really last very long. It leads to early miscarriages as well. So oligomenorrhea, why does it happen? Is because of the hormonal imbalance that is involved with PCOS. As we've discussed many times in our previous video, PCOS is caused by the underlying presence of abnormal testicular tissues or Leydig cells deep inside the ovaries. This is causing excess testosterone secretion inside these patients. So they will see all these symptoms associated with high testosterone. So the excessive body hair, the acne, the male secondary sexual characteristics, and of course oligomenorrhea. Some patients even experience amenorrhea as well. So it's very tied into the underlying cause of this excess testosterone that these patients are experiencing on a daily basis. Furthermore, they also have slightly hardened ovaries as well. So at the same time, even when the egg cell is maturing, although it takes longer, a healthy woman will only need half a month to have a egg cell or oocyte to actually mature fully, but these patients take longer. Although it still does occur, the egg cell is in poor quality because usually these patients have multiple egg cells maturing at the same time. So the quality of the egg cell is definitely not there. And furthermore, it also is unable to penetrate to the ovarian wall is because of the excessive thickness of the ovaries as well. So conventional treatment, although aside from medication, because it only deals with the symptoms, some hospitals do offer some laparoscopic surgical treatment as well. What they do is a procedure known as ovarian drilling, where they will use laparoscopic surgery and they will carefully drill a few holes on the ovaries as well. They believe that this will actually increase the chances of healthy pregnancies, and also they will believe that it can actually alleviate symptoms. However, it doesn't really do much because they believe that by puncturing these ovaries, it will actually soften the ovaries, allowing ovulation to take place. But they are not eliminating the underlying root cause, which is the testicular tissue deep inside these ovaries. So what we do here at Antai Hospital is that for PCOS, we are not allowed to go for medication because it is lifelong dependence and it doesn't really deal with the underlying cause. If you do want to menstruate regularly as well, for 28-day healthy cycle, if you want to restore that healthy cycle and also achieve pregnancy and avoid miscarriages, this surgery is a must. At Antai Hospital, what we do is that we use laparoscopic surgery and then we do it on the ovaries as well. What we do is we pinpoint these abnormal tissues, these Leydig cells that are responsible for the testosterone secretion, and we need to remove all of them. And this really does take some experience and expertise. But once patient has fully recovered from the procedure after treatment, you will see that you will begin to see that you are menstruating regularly as well, 12 times a year, 28-day cycle, and your symptoms start to dissipate as well. Slowly start to disappear. All the symptoms that are associated with PCOS will alleviate, and a healthy pregnancy can be had. So this surgery is something that we are offering for patients who are suffering from PCOS and have fertility goals as well. The sooner you get treatment, the sooner that you can actually achieve your pregnancy goals and have a better quality of life. This treatment only requires a one-time surgery, no medication, no further treatments, only one surgery, and you can achieve your pregnancy goals as well. So do get in touch with us via the website and also leave me some comments down below.